Thank you, Mr. Chairman. I'm going to present on behalf of Dr. Ana Coelho, who could not attend the meeting. I also want to thank the committee for the distinction we received from this work. These are my conflict of interests, and the study was self-founded. And so the TRUSR underactivity is really a problem which has increasing prevalence as the population is aging. And among the mechanisms that are under investigation to explain the TRUSR underactivity, one that has received less attention in the last few years is the crosstalk between the urethral sensation and the bladder activity. However, that crosstalk is quite evident, and just to recall the work of Dr. Shafik a few years ago, what they did was to anesthetize the urethra in normal subjects, in normal men, and that prevent those men to generate effective bladder contractions and to void normally. How the flow of the urine is encoded in the urethra is still unclear, but most probably might involve a crosstalk between the epithelium and the rich network of sensory fibers underneath the epithelium of the urethra. And the cells, there are cells in the urethra that are very interesting because they are ciliated, because they have neuronal-like properties. They contain acetylcholine, they contain serotonin, and releasing those neurotransmitters into the sub-epithelium that might activate receptors in sensory fibers, nicotinic receptors, and 5-HT receptors type 2 and type 3 that have been identified by Dr. Bladder in the rat. Moreover, in one paper that we are going to present also in this session, we observed that the instillation of serotonin increased the amplitude of bladder contractions and stimulate the reflex bladder contractions. Altogether, we put two hypotheses: that the aging process leading to the TRUSR underactivity could involve a decrease in the number of 5-HT expressing cells in the urethra, and as a corollary of this hypothesis, 5-HT stimulation of the urethral afferents could improve the efficiency of bladder contractions in the aged rat. For that, we selected female rats, the old ones aged between 18 and 24 months, the adult ones between 5 and 6 months, and then we performed cystometries under urethane anesthesia and at a speed of infusion of 6 mL per hour. And those that had low frequency and low amplitude of bladder contractions were at the end further stimulated with acetylcholine or ATP applied on the serosa to confirm the normal activity of the TRUSR. Then we perform immunohistochemistry in sections in old and adult young animals. We calculate the bladder voiding efficiency under saline infusion, and then we recalculate the bladder voiding efficiency in the old animals under the infusion of 5-HT. And then at the end we made cystometries under isovolumetric conditions during irrigation of the urethra in order to see what could be the effect on the bladder activity. So, starting on the cystometries, among the old animals, we could identify 12 animals that in fact had a low frequency of bladder contractions, as you can see in the representative cystometry on your left. In fact, those animals had half of the frequency of bladder contractions when compared to the young animals under those conditions of cystometries. And also the amplitude of these contractions were lower. Of course, to confirm that the truther was normal, we applied acetylcholine at the serosal surface of these animals, and the acetylcholine could generate immediately contractions. You can see that from left to right, that the bladders tend to increase in size because during cystometries, but after application of acetylcholine, immediately a strong contraction would lead to the evacuation of the entire saline that was accumulated in the urine. Other animals had a distinct, slightly different pattern. After a period of very slow number of voiding contractions, the application of acetylcholine led to a burst of contractions, and then ATP also induced contractions, indicating that the animals had a normal detrusor layer. Not all the animals that we tested had detrusor underactivity. We found detrusor underactivity in 12 out of 31 animals that we tested. That represent about 40%. A few were normal, 30% were normal, a few were overactive, and in some experiments we could not get any response from the bladder, and so we could not define what was going on because we had no bladder activity at all. And so we ignored those animals. So starting by the immunohistochemistry, on the left side you see the slender cells in the epithelium stained for 5-HT, and in fact the number of cells in old animals was half of the number of cells that we could observe in adult young animals, so confirming our first hypothesis. With age, the number of cells, 5-HT cells, decrease. Second, we calculate bladder voiding efficiency, first in young rats. And bladder voiding efficiency at these conditions, 6 mL per hour of infusion, was 80%. Then in old animals, under these conditions, the bladder voiding efficiency in those 12 animals was only 50%, 49%. To be more correct. And that explains why, during these conditions, the bladder was increasing in volume. When we changed the infusion from saline to 5-HT solution, then we immediately improved the bladder voiding efficiency back to the normal situation in the adult young animals to 80%. Then we did isovolumetric cystometries. So the bladder neck was gently closed, and the bladder was filled to 75% of the maximal bladder capacity. And during saline infusion of the urethra under these conditions, we could see occasional contractions of low amplitude. But when we changed from saline to 5-HT, we immediately saw a strong burst of contractions that lasted while the infusion of 5-HT remained in the urethra, only in the urethra. That happened in old animals, but of course it was also present, this effect, this observation was also made in young animals, and it was quite similar. So, to conclude, 40% of old female rats that we observed had the truther underactivity, and this underactivity was associated with a very low number of 5-HT cells in the urethra. These underactive female rats had low bladder voiding efficiency that could be corrected by the 5-HT infusion, so topical application. The 5-HT irrigation of the urethra triggered strong bladder contractions at bladder volumes that did not induce reflex bladder activity. And so it is suggested that, is our final conclusion, that 5-HT administration to the urethra has possible therapeutic application to improve the truther underactivity in patients that cannot have effective bladder contractions. Thank you very much for your attention.
Okay, very good. Thank you. Questions from the floor. Dr. Kanai.
Hi, Tony Kanai, University of Pittsburgh. I really like that, Francisco. That was very nice. Have you considered looking, there are thought to be taste receptors in the urethra, and they'll sense the bitterness of bacteria, and when they do that, they'll increase the force of bladder contraction to flush out the bladder, much like you're talking about with stimulation by 5-HT. Have you considered looking at that aspect?
We will consider in the future. This was our first observations, which, this opens a new opportunity in terms of the crosstalk between the urethra and the bladder. We have to consider this as an important point for the generation of bladder contractions, and all the receptors and all the stimuli have to be explored for sure.
And one last question. How would you consider administering 5-HT in a therapeutic approach to treat UAB?
First we have to confirm that this is true in humans. And for that we need a proof of concept study. We are trying to put it in our hospital. It's not easy, but for compassion in some women it might be possible. Second, we need to identify the 5-HT receptors in the human urethra, which might be completely different from the female rats.
Yes.
Thank you very much. This is Ahmad Khalifa. My question is regarding, I like the study, but how did we judge that these are underactive bladder and these are not normal bladders? You said you added acetylcholine. So how did you adjust the dosage? And you are sure that this at the threshold that can make the bladder contracts?
It's not easy to define in rats what is normal activity and underactivity.
Exactly.
And we had in mind that it had to be an activity below 2 standard deviations from the normal activity of the normal rats. And so this activity was actually very low. If you ask me if I am completely sure that this is not the effect of anesthesia, for example, because these cystometries were performed under general anesthesia, I cannot be completely sure, 100% sure. Anesthesia might have this effect, but, I am pretty confident that these animals had very low frequency bladder contractions, and in other models, the underactivity also in rats is also reflected by a low frequency of bladder contractions.
Yeah, so the question here is, how did you put the acetylcholine in the bladder? Like, what is the dosage that you used for that? How did you adjust it?
We applied on the serosal surface just to check. I can't remember the dose. It is somewhere in just to check if the detrusor was normal, because if there was no contractions in response to a acetylcholine application to the serosal, then we had to conclude that the problem was not the reflex we were testing, but the lack of activity of the detrusor.
We have one more question. Thaddeus, make sure you make it short because we're running a little bit out of time. There's another presentation on this topic later on in the session.
I can just ask it then.
Oh, it's okay?
Okay. Okay, go ahead. Okay, thank you.
Thank you.
Looking forward to the next one.